Routes and formulations. Key terms. Local effect. When drug activity is at the site of administration. Systemic effect. When a drug is introduced into the circulatory system and carried to the site of activity. Disintegration. The breaking apart of a tablet into smaller pieces. Dissolution. When the smaller pieces of a disintegrated tablet dissolve in solution. pH. A unit of measure for acidity and alkalinity, where 7 is neutral, 1 is highly acidic, and 14 represents a high alkalinity. Aqueous. Water-based. Solution. Clear liquid made up of one or more substances dissolved in a solvent. Emulsion. A mixture of two liquids that do not mix with each other, in which one liquid is dispersed through the other by using a stabilizer called an emulsifier. Emulsifier. A stabilizing agent in emulsions. Buccal. The pouch located between the cheek and teeth. Sublingual. Under the tongue. Water-soluble. The property of a substance being able to dissolve in water. Necrosis. An increase in cell death. Sterile. Referring to a product's guarantee that it is free of all microorganisms, both harmful and harmless. Diluent. A solvent that dissolves a freeze-dried powder, or dilutes a solution. Injectability. The ease of flow of a suspension when it is injected into a patient. Syringeability. The ease with which a suspension can be drawn from a container into a syringe. Depot. The area in the muscle where the formulation is injected during an intramuscular injection. Biocompatibility. Not irritating. Does not promote infection or abscess. Viscosity. The thickness of a liquid. Wheal. A raised, blister-like area on the skin caused by an intradermal injection. Ophthalmic. Related to the eye. Lacrimal gland. The gland that produces tears for the eye. Lacrimal canalicula. The tear ducts. Nasal cavity. The cavity behind the nose and above the roof of the mouth, that filters air and moves mucus and inhaled contaminants outward, and away from the lungs. Nasal inhaler. A device that contains a drug that is vaporized by inhalation. Nasal mucosa. The cellular lining of the nose. Percutaneous absorption. The absorption of drugs through the skin, often for a systemic effect. Contraceptive. A device, or formulation, designed to prevent pregnancy. Intrauterine device or IUD, is an intrauterine contraceptive device, that is placed in the uterus for a prolonged period of time. Enteral route. Any route of administration, involving the alimentary tract. From the mouth to the rectum. The 4 enteral routes include, oral, buccal, sublingual, and rectal. Parenteral route. Any route outside of, or beside, the alimentary tract. Parenteral routes include, intraocular, intranasal, inhalation, intravenous, intramuscular, intradermal, dermal, subcutaneous, and vaginal. Key concepts. Formulations. Drugs are contained in dosage units called formulations, or dosage forms. There are many dosage forms and many different routes to administer them. Route of administration. Routes are classified as enteral, or parenteral. Local, and systemic effect. A local effect occurs when the drug activity is at the site of administration. Eyes, ears, nose and skin. A systemic effect occurs when the drug is introduced into the circulatory system. Oral administration. The stomach has a pH ranging from 1 to 2. Certain drugs cannot be taken orally because they are degraded or destroyed by stomach acid and intestinal enzymes. Drugs administered by liquid dosage forms generally reach the circulatory system faster than drugs formulated in solid dosage forms. Inactive ingredients. Various ingredients contained in oral formulations besides the active drug, including binders, lubricants, fillers, diluents and disintegrants. Gastrointestinal action. The disintegration and dissolution of tablets, capsules and powders generally begins in the stomach, but will continue to occur when the stomach empties into the intestine. Modified release formulations extend dissolution over a period of hours and provide longer duration of effect compared to plain tablets. Enteric-coated tablets prevent the tablet from disintegrating until it reaches the higher pH of the intestine. Modified release formulation. Special oral formulations that release the drug with a longer duration of action compared to a conventional tablet, capsule or powder. Sublingual administration. These tablets are placed under the tongue. They are generally fast-dissolving, uncoated tablets that contain highly water-soluble drugs. When the drug is released from the tablet, it is quickly absorbed into the circulatory system since the membranes lining the mouth are very thin, and there is a rich blood supply to the mouth. Rectal administration. Rectal administration may be used to achieve a variety of systemic effects, including asthma control, anti-nausea, anti-motion sickness, and anti-infective. However, absorption from rectal administration is erratic and unpredictable. The most common rectal administration forms are suppositories, solutions and ointments. Parenteral administration. Parenteral routes are often preferred when oral administration causes drug degradation, or when a rapid drug response is desired, as in an emergency situation. The parenteral routes requiring a needle are intravenous, intramuscular, intradermal, and subcutaneous. These solutions must be sterile, have an appropriate pH and be limited in volume. Intravenous formulations. Intravenous dosage forms are administered directly into a vein. Most solutions are aqueous, but may also include glycols, alcohols or other non-aqueous solvents in them. Infusion. Infusion is the gradual intravenous injection of a volume of fluid into a patient. Intramuscular injections. Intramuscular injections generally result in lower, but longer-lasting blood concentrations than with intravenous administration. Subcutaneous injections. The subcutaneous or SC route can be used for both short-term and very long-term therapies. Insulin is the most important drug routinely administered by this route. Intradermal injections. Intradermal injections involve small volumes that are injected into the top layer of the skin. Ophthalmic formulations. Every ophthalmic product must be manufactured to be sterile in its final container. A major problem with ophthalmic administration is the immediate loss of a dose by natural spillage from the eye. Intranasal formulations. Intranasal formulations are primarily used for their decongestant activity on the nasal mucosa, the cellular lining of the nose. The drugs that are typically used are decongestants, antihistamines and corticosteroids. Inhalation formulations. Inhalation dosage forms are intended to deliver drugs to the pulmonary system, the lungs. Most of the inhalation dosage forms are aerosols that depend on the power of compressed or liquefied gas to expel the drug from the container. Gaseous or volatile anesthetics are the most important drugs administered via this route. Other drugs administered affect lung function, act as bronchodilators or treat allergic symptoms. Examples of drugs administered by this route are adrenocorticoid steroids, beclomethasone. Bronchodilators, epinephrine, isoproterenol, metoprolol, albuterol, and anti-allergics, cromolyn sodium. Dermal formulation. Most dermal dosage forms are used for local topical effects on or within the skin. Dermal formulations are used to treat minor skin infections, itching, burns, diaper rash, insect stings and bites, athlete's foot, corns, calluses, warts, dandruff, acne, psoriasis, and eczema. The major disadvantage of this route of administration is that the amount of drug that can be absorbed will be limited to about 2 mg per hour. Vaginal administration. Formulations for this route of administration are solutions, powders for solutions, ointments, creams, aerosol foams, suppositories, tablets called inserts, and IUDs. Key concepts, summary. Routes and formulations. There are various formulations used to deliver drugs for each route of administration. Enteral routes of administration refer to anything involving the alimentary tract, from the mouth to the rectum. There are 4 enteral routes consisting of oral, sublingual, buccal, and rectal. Parenteral routes of administration refer to anything next to, or beside the enteral route. Some parenteral routes use formulations that are injected. Other parenteral formulations do not require injection. A local effect occurs when drug activity is at the site of administration. Eyes, ears, nose, and skin. A systemic effect occurs when the drug is introduced into the circulatory system and carried to the site of activity. Enteral routes. Oral administration means a dosage form is to be swallowed. Drugs administered in liquid dosage forms generally reach the circulatory system faster than drugs formulated in solid dosage forms. The primary goal of modified release dosage forms is to reduce the number of doses a patient must take per day. The mouth has 2 enteral routes of administration, sublingual, under the tongue, and buccal, in the cheek pouch. Rectal administration is used for both systemic and local effects. Suppositories, ointments and solutions are common dosage forms. Parenteral routes. Some parenteral routes requiring injection for administration are intravenous, intramuscular, intradermal, and subcutaneous. Intramuscular injections generally result in lower, but longer-lasting blood concentrations than with intravenous administration. The subcutaneous SC or SQ route can be used for both short-term and very long-term therapies. Insulin is the most common drug routinely administered by this route. Intradermal administration is used for diagnostics, desensitization and immunization. Ophthalmic administration of liquids can lead to a significant loss of dose due to spillage and drainage. Intranasal administration of some drugs produce blood concentrations similar to intravenous administration. Inhalation dosage forms deliver drugs to the lungs. MDI aerosols, dry powder inhalers, and nebulizers are common devices used to administer drugs by this route. Dermal formulations vary from solutions and lotions, to aerosols, ointments and pastes. Transdermal patches are also common dosage forms. Vaginal dosage forms, creams, ointments, solutions, suppositories, are most often used for local effect. However, long-term systemic effects can be achieved with IUDs.